You love your cat, not just as a pet, but as family. You've been there through the playful years, the naps in the sun, the zoomies at midnight. But as they grow older, things begin to shift. And often, without even realizing it, we make choices, seemingly harmless ones, that quietly take years off their life. It's not because we don't care. It's because older cats are experts at hiding pain. They don't whimper or cry, they adapt. They compensate. Until suddenly, they can't. In this video, we're uncovering 7 critical mistakes that cat owners make with their senior cats. Mistakes that may seem small, but can lead to irreversible damage if left unaddressed. And more importantly, we'll show you how to fix them before it's too late. Let's begin with the one that fools almost everyone: ignoring the subtle signs of organ failure. It might start with something so minor you'd barely notice it. Maybe your cat drinks a little more water than usual. Maybe they leave a bit of food behind. Or they just don't seem as spry as they used to. You might chalk it up to age. But these early shifts are often the first signs of organ failure. Senior cats, especially those over 10, are at high risk for chronic kidney disease, hyperthyroidism, and diabetes. And these conditions don't announce themselves loudly. They whisper. Increased thirst, more urine in the litter box, slight weight loss, a coat that feels duller or greasy. These changes are subtle, and because cats don't complain, they're often dismissed as normal aging. But here's the devastating reality. By the time symptoms become obvious, your cat could have already lost up to 75% of their kidney function. That's not speculation, it's a clinical truth. Cats are masterful at hiding weakness. It's an evolutionary survival tactic. They won't show you the pain until their bodies can't hide it anymore. And when that moment comes, the damage is often already underway. If you notice any change, thirst, appetite, behavior, get a blood test. It could mean the difference between catching something early or saying goodbye too soon. Dismissing mood swings as old age. Has your cat started hissing when you pet them, acting clingy one day and hiding the next? You might think they're just getting moody in their twilight years. But mood swings in senior cats are not just a personality shift. They are often a symptom, a signal of pain, confusion, or even cognitive decline. Older cats can suffer from chronic inflammation, joint pain, or degenerative neurological conditions like feline cognitive dysfunction, which is essentially cat dementia. Nearly half of cats over age 15 show signs of it, but very few owners know it exists. Instead of limping or whining, they might act out, avoid contact, vocalize at night, or stare blankly at walls. These aren't quirks. These are warning signs. It's a red flag. And if we don't listen, their suffering continues silently. Always investigate behavior changes with compassion and curiosity. Your cat could be trying to tell you something the only way they know how, bombarding them to sleep where it hurts. You may still catch your senior cat jumping onto the couch or curling up on the windowsill. It seems fine. But what you're not seeing is the quiet strain that aging joints, bones, and nerves go through just to get there. Cats are creatures of habit. They will return to the same sleep spot, even if it's now painful, just because it's familiar. And while they may not cry out or limp, sleeping on cold floors, hard surfaces, or high perches can worsen arthritis and nerve pain over time. Even worse, some well-meaning owners move their cat's bed to a secluded area, thinking it's quieter and more peaceful. But in doing so, they may unknowingly isolate the cat from their emotional anchor points, places that made them feel connected to the family. If their favorite spot is now a painful one, your cat might be suffering in silence every single night. Make it easier. Add a low, soft bed in their favorite room. Use warm orthopedic bedding. Make the familiar feel safe again, without the struggle. Assuming they're fine because they're quiet. A quiet senior cat isn't always a peaceful one. Sometimes that calm you see, it's the calm before a health crisis. Cats have evolved to mask symptoms. In the wild, showing pain meant danger, so even when they're hurting, physically or emotionally, they stay silent, they retreat, they adapt, until the damage is too great to ignore. Dental disease, kidney failure, high blood pressure, tumors, Many of these progress for months or even years without outward signs. And by the time your cat stops eating or starts hiding, the illness has likely advanced beyond an easy fix. Skipping vet visits, especially for senior cats. Your older cat needs a checkup at least every 6 months. That simple routine could catch something early enough to treat. Don't rely on silence as a sign of wellness. Be proactive. Catch it before it catches them. Change their routine without realizing the damage. A new litter box, a different feeding schedule, furniture rearranged, a longer time away from home. You might think they'll get used to it, but for senior cats, even minor disruptions can be traumatic. Aging affects more than just joints. It affects memory, orientation, and sensory perception. Vision dims, hearing fades, cognitive function declines, and their routine, their daily rhythm, is often the only thing holding their sense of the world together. When you suddenly shift their environment, you risk creating stress, disorientation, and anxiety. And for an older cat, that kind of emotional shock isn't just uncomfortable, it can lead to digestive issues, immune suppression, even illness. Give them time to remap their space. Predictability isn't boring to a senior cat, it's safety. Take it away too fast, and you don't just stress them out, you shake the very foundation of their peace, missing their quiet. Pleas for connection. Older cats may not follow you around like they used to. They may nap more, play less, and seem content to be left alone. So we start giving them space. But here's the heartbreaking truth. Many senior cats don't withdraw because they want to. They withdraw because they feel forgotten. As they age, cats often become more emotionally sensitive, not less. They notice when you stop talking to them. When their favorite lap becomes off limits, when the household energy shifts and they fade into the background, that slow blink from across the room, the gentle head bump, those aren't random. They're questions. Are we still okay? When those signs go unnoticed long enough, your cat might stop trying. That's when the emotional damage begins. Let them know they still matter. Because for a senior cat, emotional connection isn't a luxury, it's a lifeline. Overlooking their grief. Cats feel loss deeply. And when a senior cat loses a bonded companion, be it a sibling, another pet, or even a human, they don't just move on. They grieve. And their grief can look like many things. Hiding, refusing to eat, crying out at night, sitting in strange places, or staring blankly at nothing. These aren't behavioral quirks. These are symptoms of a heart that doesn't know how to heal. Grief isn't just emotional in cats, it's physical. It affects appetite, immune function, even organ health. Some cats never recover, not because their body failed, but because their spirit did. Unfortunately, many owners misinterpret this grief as moodiness or aging. They give the cat space, thinking it's what they want, but what they really need is you. Be present. Be calm. Don't rush the healing, but don't retreat either. Just let them feel your steady presence. Let them know they're not alone in their loss. Because for a grieving cat, your consistency is the beginning of their recovery. Conclusion. These mistakes, each one of them, is easy to make. None of them come from neglect or indifference. They come from not knowing how silently cats suffer and how little it takes to make a difference. A warm bed, a gentle hand, a vet visit before the crisis, a few extra minutes of eye contact. These aren't grand gestures. They're the small lifelines that tell your cat, I see you, I still love you, I'm here. Your cat may not be able to say thank you, but they will show it in the way they blink at you, the way they purr when you touch them, the way they trust you, even at the end. So let's give them the care they deserve, not just when they're young, but especially when